Chief Clinical Officer for Hartford HealthCare. Thank you very much for being here today. So as a regular update, I'd like to go over a few of the items, number of patients we have in Hartford HealthCare, how's our staff doing, what's the surge model looks like, what update on the MIT model as well. And we'll talk some about our staff. I think that's a really important thing, the resiliency and the work has been done by the members. And after that, my colleague, Colin Mulcahy, is going to join and talk about other important updates from Hartford HealthCare. So as far as the numbers are concerned, we are seeing about 10 to 15% increase in every single day on the number of patients who are either COVID positive or person under investigation. Today, our number is 254 positive across the Hartford HealthCare and 113 PUI. Mind you, these numbers also includes our community network and behavioral health network as well. As we move into the surge, we have created a behavioral unit, which is COVID positive. A really important distinction, and I'm probably one of the only ones in the country, as best I know, who's doing it, because we understand our individuals who have a psychiatry needs here, still needs that level of care and expertise, and we are fortunate to have a large behavioral health network in Hartford HealthCare to be able to create a specified designated unit for individuals to be able to manage. We also have a large community network. As you know, we have a lot of patients who are in home care, who are in our hospice support and many other areas. So that number is also we're reporting today. We have had several patients recovered as well. The good news is that we have about 80 or more patients actually who recovered from this disease since we've started in this journey, and we're really happy that those folks have been are back in the community. Our largest number is still in Hartford Hospital. We have over 101 patients who are positive, and second largest in St. Vincent. We've seen a significant increase in our St. Vincent volume. Every day we are adding 10 to 15 patients in the cohort of patients who are either COVID positive or PUI. Now, as we think about these numbers, we always think about that, how are we going to manage the next phase, the surge, as we talk about. Now, as I indicated last week, we're working with MIT to develop the model. We have an internal Hartford HealthCare modeling as well being done, and there are a couple of individuals, Dr. Barry Stein and Dimitris Barstamatis, who's the professor from MIT, and myself and some other members will come forward during this week sometime and talk about the model in detail. But the model actually is very comprehensive. It takes care of several different variables. It takes care of the amount of infectivity rate we have, is that how this virus can infect, depending on the social distancing practices we are performing in Connecticut, and that's a variable which changes, unfortunately. We also look at the incubation period, how soon this virus replicates and how many individuals can get affected. We're also looking into the demographic of the number of patients actually who are at certain age in the state of Connecticut and how this model will play out. Currently, our predictions are based on MIT, slightly different than what has been presented in national level. We think we're going to hit this peak in Connecticut sometime in end of April and first week of May, sometime around that time period, about 5th or 6th of May. That is the time we are anticipating at this time. Our capacity will stress our ICUs specifically across the state of Connecticut. At this time, looking at the numbers and looking at what the state has been doing, and I'm so proud the governor has taken really good actions in getting all the hospitals together, led by our CEO, Jeffrey Flax, Mana from Yale, and John Murphy from Nuance. I think the teams are really making a lot of good progress and looking into the capacity across the state. So I feel comfortable at this time as the state of Connecticut will manage what's to come over the next several weeks. We still have some work to do. We still have some work to do in our making sure the right amount of equipment, such as ventilators and IV poles and things like that, are appropriately designated to the right places across the state, and we need some more help, either from state or from federal government, to be able to supply those details. Also, the PPE continues to be a challenge. As the number goes up, our burn rate of the PPE goes up, and we need to make sure that the entire state has the right supply of those as well. So these numbers are manageable with appropriate support. And I feel confident at this time that we will get through this over the next several weeks. Now, there was a lot of talk about the critical week ahead and how we are prepared. I think it's going to be have several critical weeks ahead, not just 1 week ahead. And I think when I talk about the preparation, we need to talk about in multiple different ways. Is that how are we positioning as a state to take care of the critically ill patients and supporting them in the times of need? But at the same time, how we're preparing our colleagues, our staff members, our physicians and nurses, and many other individuals who actually take care of patients, how we're preparing them as far as the resilience is concerned, how are they seeing the support from the state and system and the community to be able to work along this line. This is a long marathon, and it's going to continue for several weeks. Even when we hit the peak, it doesn't mean the peak goes away. The plateau still continues for some time, and the stress on the healthcare workers is going to continue for some more time. So this is a somewhat of a long fight. It's not a short fight. So I don't want to send a message to the.
So I just want to know us. You've seen this on FTC. Sorry about that. New York City Mayor de Blasio holding media availability at the Brooklyn.
Can I ask you to just be on the mute for a moment? Somebody's speaking. I'm unable to continue my conversation. So when we talk about the resiliency and we talk about how the staff is prepared, that is our focus. And Hartford HealthCare, that's where we're focused right now. We're thinking about how we support our teams, how we support our nurses who are really going through a significant amount of emotional exhaustion at times, actually, and over the time it's going to continue. And I think this is happening across the country at this time. But we feel prepared in Hartford HealthCare. I think we have good people who are really working hard to make that happen here. The other part which I was hoping to talk about is the testing numbers and drive-throughs. We still continue to have the challenge with the viral transport media. We are assessing the rapid testing capabilities within the Hartford HealthCare. We've ordered some machines, and hopefully soon we'll have a capability of doing that. But the turnaround times, especially in outpatient labs, is still about 3 to 5 days. Inpatient, we are fortunate to have within 24 hours, and with Jackson Lab support and internally Hartford HealthCare. So we continue to plug along on that part here. I do want to talk about social distancing one more time. I think it's important time. Pretty much every single time I've come in front of the camera, I've talked about that. This is something to be taken very seriously, and this needs to be continuous dialogue among the community members as well. The way this virus works is the connection is that one person can connect to the second, and that chain actually keeps this virus alive in the community and creates a challenge for us. As a lot more patients actually get the infection at the same time, it creates a significant stress for our hospitals to be able to manage that. And the chain needs to be broken. Even a casual going out in the field with some other family member from a member of some other family, you're passing the transmission risk to the other member. This has to be maintained within the family units. It has to be maintained in a geographical. And so stay home. Casual coffee outside, casual walk in the park with some other family member. Unfortunately, at this time, we'll have to just avoid that. And we're going to get through this over the time, and we're going to win and succeed in that part here. But today, my plea would be keep the social distancing topic alive in your dining rooms and your discussions with your family members, your kids, and other members. This is not something to be taken lightly. I stress again, it's a serious matter to manage the social distancing. With that said, I am going to pass to my colleague, Colin Mulcairn, who's going to talk about other details. Thank you very much. Colin.
Good morning. One of the things that we talk a lot about when we talk about social distancing is trying to start to think about ways to reframe that to physical distance. One of the issues that's really important for our patients, for the families that are worrying about them while they're here in the hospital, and for our staff is to maintain those connections, trying to be as creative as possible to think about ways that we can hold on and maintain connection. So that we do that virtually. Our telephones are really important. So whether it's FaceTime or conversation to connect with each other is one of the things it's so vital to get through this unprecedented time. As Dr. Kumar is mentioning, with thinking about things for social distance, the importance of really having a chance to support each other as colleagues. Our staff is really in a good place to be able to have the resources available to support each other. So we have peer support that's formal and informal, ways to take care of each other as colleagues, as such an important part of what's going on. A lot of times we get asked what you can do as how to support healthcare workers, and what we're really feeling is sometimes just the simple thank you. Coming home from work one night, one of my neighbors had a beautiful heart out in her yard, and it really made all the difference when you're tired and you see those thank you notes. One of my physician colleagues said that his wife, that are a couple that are both docs, and came home and there was a dinner waiting from a neighbor on their porch. And so sometimes it's just the little things to support healthcare workers. And as Dr. Kumar is mentioning, is maintaining the social distancing. So really it's a chance for us to really take care of each other and to maintain those connections. As family, if you have somebody here in the hospital, help us get to know them. Tell us the favorite music that they'd like to hear, and what TV station should be turned on, and how we can make them connected to the things that we can do virtually when we can't do physical presence. So wanted to have a chance to open it up if you had any questions for me, or if there's questions for Dr. Kumar.
Hi, it's John Billis-Fox. I have a question for Dr. Kumar, actually a couple of them. You've mentioned, Dr. Kumar, that you're seeing 80 patients have recovered, and I'm trying to find out what is that percentage of the total admitted patients that you're dealing with?
The recovery, the total percentage of that, it's a great question. I haven't done the math on that, actually. I should be able to report to you tomorrow on that part here, but we are, I think the challenge we have right now, the patients actually who come into the hospital, they'll stay for such a long time, depending on which data point you take on the recovery side. But I'll present this to you. I would guess it's about 25 to 30% patients who are inpatient, who are being transitioned out there. But a lot of patients actually come into the emergency room as well, who are evaluated and felt to be managed at home as well, who are COVID positive. So I'm not talking about those numbers, but it's a great question. I should report back at some point.
Okay, the other question I had while I have you still on the phone here is capacity. So we're going into what we think is going to be a couple of really tough weeks in terms of the surge. Mm-hmm. And what is your capacity at Hartford Hospital and at your network hospitals in terms of physical beds available? Are you at 8%, 90%, 99%? How does that work?
I think so. This is there are two different conversations. I'll try to explain as best I can. So we have a finite capacity in the Hartford HealthCare, which is the normal operation capacity. 1,900 beds allocated. We have a lot more licensed beds in the organization. Because our elective surgeries have gone down, because of the trauma has gone down, because of other type of admissions are gone down, we suddenly have created more capacity to manage for COVID patients. So if you look at the totality of that, the number of patients we're caring, we are about 60% capacity. So we've got a lot of capacity to go up to the level where the system will be stressed, or at least to the point where we can't match it. The overall capacity may or may not matter a whole lot. What matters is the ICU capacity, because these individuals require critical care type services, and that's where the capacity is basically defined by the number of available beds you have, the ventilator, the poles, the mattresses, and everything else. But at the same time, the staffing side, the number of nurses and doctors and other type of specialists we require to be able to manage those patients here. Now, the way we think about it is that we can actually add 1,000 more beds in our current compound across the Hartford HealthCare. But how do you actually get to the support staff, the nurses and doctors to support the 1,000 more beds? That's where the rubber hits the road here. So right now, as we think about it, our capacity in Hartford HealthCare is about 180 plus ICU beds, normal operating. That's a normal day and not in the COVID time. But we can go up to 300 right now with the staff and capacity very easily in about a week's time. So as I described to you, so our capacity can almost, not double, but close to double in very short time if needs arrives. Now, the second part of that is our moderate capacity expectation. The second part is that really things go in a poor fashion, such as Italy or something like that. I hope not. Then we need a lot more capacity. We need to add another maybe 100 or 150 ICU beds at that time. So we have done an assessment where would the beds would go and how would we categorize those beds. And we've started training our nurses and physicians and creating a virtual capacity creating a e-ICU model and things like that. So we're preparing for that. This week we'll have an e-ICU model complete, so we can manage that capacity as well. Then the next phase comes in. What if the other part of the state is unable to manage? Hartford HealthCare is still the safety net hospital for the system, for the state of Connecticut. And how do we support the other hospitals, smaller hospitals and other ones who either run out of PPE or don't have a capability? How do we position for ourselves? So we're thinking in a very sequential way, is that as a surge goes up within the Hartford HealthCare or outside, how do we react at that time here? So our surge capacity number changes based on that. So at this time, I can tell you within the Hartford HealthCare, based on the model we have, we are comfortable in managing what is to come at this time. What we are assessing at this time, if the other hospitals are unable to manage or somebody else, how's the Hartford HealthCare going to respond to that? We find it's our responsibility to be supportive of the state's need at this time, and we'll continue to work on that. I hope that answers your questions. Long-winded answer, but gives you kind of a context as you like to write in your newspaper.
Yeah, the other thing, and I'm not gonna, I don't want to hog this, but you mentioned about PPE and that kind of struggle that you're dealing with, and how are you dealing with it? What are your restrictions? Are you having to recycle materials? What's going on with that?
Yeah, so we, I think when I talk about PPE, I always want to put in the context about the discipline we've had in the organization. And it's really important to talk about it. We've had the discipline from January. Looking into what is to come is that how are we going to use the PPE, who's going to use the PPE, how are we going to cohort the patients, how are we going to move the IV poles and the ventilator out of the ICU, how are we going to create the virtual capacity, how do we create the team structure differently to minimize the use of PPE. And it's not just about the PPE, it is about protecting our colleagues. There's the amount of exposure individual has with the patient who is actually positive for COVID. We want to minimize that to the right size, to the patient gets the right care, but the staff actually does not get the exposure more than required at the moment. So when we think about all that process, we've already put that in place. Now the second part is supply chain. How do we acquire the PPE either from different vendors, China or local, or the donations we have received, or the partners who have actually supported us differently? So we put that in inventory and we plan this out, what the burn rate is going to be and how we're going to be managing that part here. So at this time, our supply chain has done a tremendous job. So we were able to secure PPE pipeline for some time. Our community has given us a fair amount of donation, which has really helped, and I'm very thankful for that. With the discipline we put together across the system, we're confident that we're going to go through the April as well. And in the meantime, I want to highlight that we've actually implemented some neat policies. We have been giving a mask to every single colleague across the Hartford HealthCare who's in the clinical area. It's a big undertaking to be able to support almost 15,000 individuals across the system who are in the clinical area to be provided with a mask. We're not restricting anything at this time for the colleagues. However, we're following the strict policies and the procedures we put together and the CDCs put together. So individual actually who's going to be in the aerosolized area, who's going to be intubating, needs the N95 and face shield, we have that available. But individual who's actually going check on the patients, to making sure the patient is okay, who's COVID positive, we have appropriate gear, but not necessarily the face shields and everything else needed at the time here. So the discipline and how we're rolling that out is really critical at the moment.
Dr. Kumar, this is Emily Brinley from the Hartford Current. Over the weekend, the president of the American Medical Association made a comment on CNN that the use of hydroxychloroquine could be dangerous for patients because there hasn't been enough studies on it. I know that the Hartford HealthCare hospitals are using hydroxychloroquine for certain COVID-19 patients. Can you comment on those concerns about safety?
Yeah, so I want to emphasize the fact that I never want to give a medical advice on the TV. I would probably go wrong half of the time, so I want to make sure I'm careful with that part here. However, hydroxychloroquine does increase risk for the cardiac incidences and arrhythmias as well. So this is not a medication to be taken lightly. It needs to be taken by the appropriate guidance of the clinicians who are able to make sure your EKG is okay, you've got acute intervals are fine before you get that. So we have a lot of protocols and safety precautions to put together before we give this kind of medication to any individual. We are using this medication for selected population who are at the stage when we call it the moderate decompensation, where the oxygen requirement is high, they're in the ICU or about to go to the ICU, sometimes on the floor. So we're using this medication for some patients, but it needs to be taken very carefully. It needs to be appropriately guided by the right oversight. And I would encourage community members not to seek for hydroxychloroquine prescription. It could hurt you more than make it better. And still, it's FDA approved because we don't have anything better, but we don't know whether it is the right medication which is going to work for a long time. So that's where we are right now, unfortunately.
And then on the ventilator capacity, how is your capacity in the Hartford HealthCare system right now? How many ventilators are in use right now, and how many more do you have?
I had the number this morning. I think we have about 167 ventilator in use across the system, about that number, maybe off two numbers here and there. But we have about 370 something ventilator available for us to use. So we're comfortable at the moment, and we are, as a state, we are working together. And other day, Stamford Hospital required some ventilators. We sent 6 ventilators to them as well to support them. Hartford HealthCare is seeing this is a state issue, this is a country issue, not just the Hartford HealthCare issue. And we want to make sure we support the entire community. It doesn't matter whether they are part of Yale or Nuance or Stanford or a standalone hospital. We're in this together, and this is a fight for all of us to get through.
And just to clarify on those numbers, that was 370 ventilators total, including the 167 already in use?
Emily, if you're going to quote me on the newspaper with these numbers, I'm going to take my numbers back. Approximate, we have about 60% use of ventilation use at this time, and we are comfortable to manage the surge to come. That would be the right statement to make.
Okay.
Good morning, Dr. Kumar. I have 2 questions. It's Bridget from the Republican American. The first relates to the earlier question about percentages of patients that are released.
Mm-hmm.
Of those patients who go into a stage of needing to be intubated and ventilated, what percentage of those patients ultimately leave the hospital?
Yeah, again, it's a great question. I don't have the data in front of me, but we've seen actually a reasonably good amount of patients being extubated or taken, the tubes been taken out and off the ventilator and been transitioned out of the hospital. But we're seeing some success in that. So, but however, still, it's a deadly disease. The folks actually who have certain age risk, age-related risk or comorbidity, they don't do all that well. So we've seen some mortality as well with that.
Okay, and the second question would be, we have heard back that Charlotte Hungerford has had an increase in patients as well, and that their morgue has been run out of space. I think they have 6 spaces there. Is there anything about that?
I don't know where you're getting your numbers from. I admire you for that. Charlotte Hungerford actually has a reasonably good amount of space. They have seen increased number of patients. As a system, I want to highlight one other part here is, we have for several years, our Hartford HealthCare works in a really true as a system. We have a care logistics center who monitors the activity in every single unit, every single organization, the capacity we have. And we have a capability of moving patients around within the system, so we load level if needs to be. So when we talk about individual unit of Hartford Hospital being at capacity, it is generally a half of the conversation because the other part of the organization has a large capacity. So when we think about our capacity, we load level, we think about how it needs to be appropriately manage patients across the system, and our care logistics center, which is a state-of-the-art system, which actually looks in the entire system's capability, whether it's a people, whether it's a space, manages that very well every single day, 24 hours a day.
So they have not run out of space in their...
Well, let me put it that way, Hartford HealthCare has not run out of space.
Okay.
Hi, Dr. Kumar. This
Yep.
is Danielle Gonzalez with WTIC. I just have one quick question. Has there been anything new that's been learned about the virus itself?
What has been new about the virus? It still continues to puzzle us. One of the things which we know at the moment is that it does not cause reinfection. That has been we have not known, at least any data suggests it causes reinfection. That's a very important thing to know. The other part is that we're learning there's a new antibody testing might be coming down the pipeline, which we are exploring at this time, and the Hartford HealthCare is working on that as we speak. And that might help us to understand how many patients are already infected and who have recovered, which is a good thing because the workforce can come back and we can open up some of the work we do across the country. Other than that, the virus, what we know a little bit about, we know very little about this, the behavior, especially in the asymptomatic piece, the individual who are asymptomatic, and how they can transmit the virus. But there's a lot to be learned. This virus has been the most trickiest one we've seen for a long time to manage. And I think I'll end at that. I don't know whether we have anything else new which I can share this time.
Dr. Kumar, it's Lisa at News 8. Could you repeat what you just said about reinfection, please?
So there's no data to suggest that this virus, once it's infected individual and they're recovered, can cause reinfection. There's no data to suggest that.
And to follow up about Dr. Kumar, there is some very successful work with using the plasma of those who have recovered on those who are critically ill. Is that something that Hartford HealthCare is investigating as well?
Yeah, actually this morning, in fact, I was on some of the email conversation. Our teams are very much actively looking into that, and who knows, by tomorrow they might start using it right now, but they're very much on top of it. If there's no other conversation or questions, I'd like to make one more comment. Social distancing, please do write in your newspapers and media articles and all that. It's critically important. We need to break the chain of transmission. We need to make sure that we continue to adhere to what has been put out there. It is not to be taken lightly. There is one way we can get ahead of the curve. Please visit our website, hartfordhealthcare.org/coronavirus. Our COVID hotline, 860-972-8100, and please thank all the healthcare workers and all the emergency individual EMS folks. Please help all the people who are supporting us from supply chain and other area, all the community members, the environmental services, the folks actually who are supplying our medications, and people who are cleaning the rooms, and people who are the nurses and doctors. Please do write a thank you in your newspapers.
Thank you, everybody, for joining. Dr. Kumar, we're getting several questions on Facebook with regards to social distancing.
Yeah.
Is it actually working because the numbers are still going up?
It is still working. It is still working because numbers are going up, and I can tell you that although it might sound that we don't see immediate result of that, as you know, that the social distancing is helping us delaying to some of the peak we are seeing right now, and that is a win in a small way. It is still working.
Another question from Siobhan. Are non-essential surgeries canceled past April 30th?
Yes, Siobhan. Yeah, they are canceled till, I believe, May 5th at the moment, but we're going to continue to reassess on a weekly basis, and most likely will get postponed further.
A question from Renata. Will they be using hydroxychloroquine to treat in Connecticut?
We are using hydroxychloroquine to treat patients in hospitals in Connecticut. And we're going to continue to do so as long as the evidence supports it.
Okay. Looks like I think those are the questions. Yep, some questions.
Well, thank you very much. I appreciate everybody's time, and be well.